If you're queer and rural, if where you live, you cannot find a filming provider within 30 miles radius. If you learn to stay smaller, quieter, less visible to be safe, I have bad news for you. Science has been watching you and decide to look away. I'm Yoyce Geronimo. I have a master in clinical and counseling psychology. I work with the community that the system is failing to serve. Today, we will talk about what is the impact on the queer community living in rural areas. This is Health and SIM, connecting the dots. Today, we are reviewing a study from the Texas A&M University. They has a question that should have been asked a long time ago. What do we actually know about the health of rural LGBTQ plus people in this country? To answer that, they searched every major academic database. They pulled together every peer-reviewed study focused on rural LGBTQ plus health in the United States, published between the 2000s and 2024. Before I tell you what they found, I want to tell you why this kind of study matters. The research that exists or doesn't exist about your community shapes everything. It shapes how doctors get trained. It shapes which program get founded. It determines whether the clinic in your county ever hire a filming provider, whether the insurance code exists for the care you need, whether the grant gets written to build the support group that is not there yet. When scientists don't study you, what you need doesn't get built. That's simple. Because of that, I'm happy to see that scientists finally has that question. However, what they found is devastating. There is about 3 million queer people in rural America. In 24 years, only 167 articles were published about the health of rural queer individuals. Compare that with the over 300,000 studies published just last year on mental health. That's not a gap in the literature, that's abandonment. In early 2000, about 3 articles were published per year. By 2013, the number increased to 12. But we need to remember that 2013 was the boom of DEI. Federal government started funding research and programs on DEI. So organizations added those beautiful letters to their mission statement. And with the same speed that it was up because it was convenient for them, as soon as our current administration started attacking DEI, with the same speed, they took it down. So back to the study. Of those 167 studies done in 24 years, 83% included gay and bisexual adult men in the sample. Almost no representation for transgender, gender diverse people, lesbians, bisexual women, teenagers. Almost half of the study were focused on sexual reproductive health, HIV testing, condom use, PrEP, STI transmission. I'm not saying that that's not an important work, but what about our queer, rural people, mental health and substance use? If you thought that things cannot get worse, I'm sorry. But majority of the study were describing the problem, measuring how bad things are. Yes, they show that queer people has worth health, but actually I should say they show that bisexual and gay men has worth health outcome, because females were represented in only 6%. You can generalize only a 6% of the sample. I'm sorry. And then they stop. They look at the problem and they stop. In 24 years of research, almost no interest in testing an intervention, in finding a solution. The field spent 2 decades documenting suffering. I know that there is value in knowing what is wrong, because you cannot fix what you don't know. But when 80% of the research is excretion in 24 years, you have built a monument to the problem and a comfortable seat to look at it and feel pity about that. Now, something was found that quite honestly is not surprising. 1 in 4 studies were self-funded. No federal, state, or private foundations money. Just real people from our community using their time, their resources, their money to find a pathway. And quite honestly, this is how our community has survived for decades, so I'm not surprised. So we have about 167 studies about the life of rural gays and bisexual men, mostly about HIV, documenting the problem rather than finding a solution. What does that mean for you? I have 4 things I want you to bring home with you today. First, your visibility in the research is not a reflection of your importance. The absence of data about rural queer women, rural trans people, rural LGBTQ elderly, and adolescents, that absence is a failure of the system, not a statement about your value. Second, when you struggle to access care that fit your life, there is a structural reason for that. It's not that you are asking too much. It's that the evidence base needed to build better system to train providers to justify fundings, to design programs that actually work, has been underfunded for decades. Your experience of struggling to find care is the consequence of the government neglecting you. That's not a personal failure. That's a policy outcome. And that brings me to the third one. Pay attention to what is happening to research funding right now. This is not background noise. This is not politics happening somewhere else to someone else. The little research that exists about our community, the 167 study that took 24 years to produce about the LGBTQ people living in rural areas, was built partly on federal funding that is now being cut. DI became a bad word overnight, and the study that were supposed to connect the ones that would have finally looked at the rural queer women, at trans people, at our elderly and teenagers, those may have never come out. So protecting research funding is not an extra civil duty, it's a self-defense. Know what is being cut. Say something about it, because silence right now is how the next 24 years look exactly or worse than the last one. 4, the thing that has actually helped were often built by the people inside our community who refuse to wait. These things exist not because the research cut off first. They exist because people inside rural LGBTQ communities decided that waiting for the data was a luxury they couldn't afford. That has always been how marginalized communities survive. Not by waiting for the system to study them into worthiness, by building what they need with what they have. Here is what I want to leave you with today. Science failed rural LGBTQ plus people slowly through choices about what to find, who to find, and what question we're asking. That failure has consequences in real life, in providers who wasn't trained to see you, in the programs that never got built, in the support that wasn't there. And here is what I also know. People build things anyway. They build peer support, community organizations, and online spaces and chosen family in places where the physical infrastructure didn't exist. They held each other when the data didn't recognize them. They survived, often without a map. This show exists to be part of that map. Every episode, we are going to take that data and show what science knows or doesn't know, and we are going to put it in your hands.